Pregnancy is often described as a beautiful journey filled with anticipation, joy, and preparation for the arrival of a new life. But for many women, it can also be a time of worry, fear, and emotional strain. Anxiety during pregnancy is more common than people realize, and it can range from occasional nervousness to more serious and persistent anxiety disorders. What's important to understand is that anxiety isn't just in the head. It can have real effects on both the mother and the baby. Knowing how to manage it can significantly affect the overall pregnancy experience. Understanding anxiety during pregnancy. Feeling anxious occasionally is normal, especially during pregnancy when your life changes significantly. But when these feelings become constant and intense and start interfering with your ability to function daily, it might be a sign of an anxiety disorder. Anxiety disorders involve more than just worrying about the baby's health or the labor process. They involve an overwhelming sense of fear or dread that won't go away, no matter how much reassurance you get. This kind of anxiety can show up in different ways. Some women might experience racing thoughts they can't control, constantly worrying about something going wrong. Others might have physical symptoms like a racing heart, chest tightness, trouble breathing, or even feeling dizzy and disconnected from reality. These symptoms can happen in waves or even come on suddenly in what's often referred to as an anxiety attack or panic attack. For some, these attacks are mild and pass quickly, while others might feel like they're in the middle of a medical emergency, with their body in full fight-or-flight mode. Why anxiety happens during pregnancy. There are a few reasons why anxiety might increase during pregnancy, and one of the biggest culprits is hormonal changes. Pregnancy triggers major shifts in hormone levels, especially in estrogen and progesterone, which can affect mood and stress levels. This biological shift alone can make you feel more emotional and vulnerable than usual. Apart from hormones, the sheer responsibility of bringing a new life into the world can be overwhelming. Many women start thinking about whether they'll be good mothers, whether they'll have complications during birth, or how they'll manage financially and emotionally after the baby arrives. If you've had previous miscarriages, traumatic births, or struggled to get pregnant, the fear of something going wrong might be even more intense. Also, women who already had anxiety before getting pregnant may find that it worsens, while others may experience it for the first time. Then there's the pressure from society, family, and even social media. The image of the perfect pregnancy or being the perfect mom can add extra stress, especially when reality doesn't match up with those expectations. The effects of anxiety on the mother. Anxiety doesn't just affect your thoughts, it can impact your entire body. Women dealing with high levels of anxiety might find it hard to sleep, have trouble eating properly, or experience constant fatigue. Restlessness, irritability, and a general feeling of being on edge can make it hard to enjoy the pregnancy or focus on daily tasks. Over time, untreated anxiety can also take a toll on physical health. Chronic stress can lead to higher blood pressure, tension headaches, and digestive problems. It can also contribute to more serious complications like preeclampsia, a condition that involves high blood pressure during pregnancy and can be dangerous if not managed properly. Mentally, anxiety can create a cycle that's hard to break. The more you worry, the more stress your body produces, and the harder it becomes to calm down. This can lead to helplessness and isolation, especially if you feel like nobody understands what you're going through. The effects of anxiety on the baby. When a pregnant woman experiences prolonged anxiety, it's not just her who's affected. The baby can feel it too. Anxiety increases levels of cortisol, the body's stress hormone, and this hormone can cross the placenta. This isn't harmful in small doses, but when cortisol levels stay high for too long, it can impact the baby's development. There's research that shows a link between high anxiety during pregnancy and an increased risk of premature birth, low birth weight, and even complications during labor, such as very long or very fast deliveries. Babies born to mothers who experienced high anxiety might also show delays in reaching developmental milestones, especially in areas like speech, motor skills, and emotional regulation. Some studies have even suggested that these babies might be more prone to anxiety or mood disorders later in life, although this isn't always the case. It shows that a mother's mental well-being plays a role in shaping the early environment the baby is exposed to, even before birth. Recognizing when anxiety is a problem. Many women struggle to know whether what they're feeling is normal or something more serious. A certain amount of worry is natural, but if it becomes difficult to control, leads to physical symptoms, or affects your ability to take care of yourself, it might be time to seek support. Trouble sleeping, loss of appetite, constant tension, and withdrawal from people or activities you normally enjoy can all be signs that anxiety is taking over. In some cases, the anxiety can become so intense that it leads to panic attacks, sudden episodes of extreme fear with symptoms like chest pain, dizziness, trembling, and a feeling that something terrible is about to happen. These attacks can be terrifying, especially if you've never had one before, and they often leave women feeling exhausted and frightened. Managing anxiety during pregnancy. The good news is that anxiety during pregnancy is treatable. You don't have to suffer in silence or just tough it out. There are several ways to manage anxiety, both naturally and with professional help, and what works best will depend on your specific situation. Talking to a healthcare provider is a good first step. Many women hesitate to bring up mental health concerns during pregnancy, fearing they'll be judged or dismissed. But mental health is just as important as physical health, and doctors are trained to help or refer you to someone who can. Therapy, especially cognitive behavioral therapy, has proven to be very effective for managing anxiety. CBT helps you understand how your thoughts affect your feelings and behavior and teaches you how to shift negative patterns into more constructive ones. It gives you tools to challenge your fears and take control of your anxiety instead of letting it control you. For some women, lifestyle changes can also make a huge difference. Regular exercise like walking, swimming, or prenatal yoga can help release tension and improve mood. Eating a balanced diet with foods rich in omega-3 fatty acids, found in fish like salmon or plant-based options like walnuts, can also support brain health and emotional well-being. Getting enough rest is crucial, even if that means taking naps during the day or going to bed earlier. Mindfulness and relaxation techniques, such as meditation or deep breathing exercises, can also help calm the mind. Spending even a few minutes each day focusing on your breath or doing a guided meditation can create a sense of peace and stability, especially during moments of heightened anxiety. When to consider medication. In some cases, anxiety might be severe enough to require medication. This decision is very personal and should be made with your doctor's guidance, weighing the risks and benefits. Some medications are considered safe during pregnancy and can help manage symptoms that might otherwise be harmful to both mother and baby. If you've been on anxiety medication before pregnancy, don't stop abruptly without consulting your doctor, as that can make symptoms worse. The role of support systems. Having people around who understand and support you can make a world of difference. Whether it's your partner, family, friends, or a support group of other pregnant women, sharing your worries can help lighten the load. Talking about your fears doesn't make you weak. It shows that you're taking steps to care for yourself and your baby. Sometimes just having someone listen without trying to fix everything can be incredibly comforting. It's also helpful to educate your support network about what you're going through so they know how to help in meaningful ways. Embracing the journey. Pregnancy is not just a physical journey, but an emotional one too. Anxiety might try to steal your joy or make you doubt your ability to handle motherhood, but it doesn't define your experience. With the right support, treatment, and self-care, you can manage anxiety and focus on the excitement and beauty of bringing new life into the world. It's okay to ask for help, to have bad days, and to not always feel glowing or blissful during pregnancy. What matters is that you're doing your best to care for yourself and your baby. The more you understand about anxiety and how to manage it, the more empowered you'll feel as you navigate the ups and downs of pregnancy. And remember, you are not alone. Many women have walked this path and found their way to a healthier, happier experience.